ALS.
Now, you mentioned to me before we started recording something about gene therapy and the FDA.
Yes, actually that has to do with stem cell research.
Stem cell, okay.
Yeah, which is so important and really interesting. And that is that this year, since we talked to you last year at this time, in 2009, the FDA approved its very first stem cell trial here in the U.S. And that's been something that has been a while coming because I know that scientists were concerned about the dangers that may be involved with it. However, they think that they have developed a safe method for injecting these stem cells, and the first FDA-approved trial is currently going on.
Now, what would happen inside a person's body who received stem cells? Would it be regenerative?
What they're trying to do is make these stem cells mimic healthy motor neurons. So the science is still very young, and there's still a lot to learn. But that is the ultimate goal, is to get these stem cells to mimic a healthy motor neuron. But a lot of times, ALS patients have already lost so many motor neurons. They're just dead.
We're talking with Kamden Kuhn about ALS, Lou Gehrig's disease. And again, it is a disease that cripples someone. They lose all use of muscles, every muscle in their body, sooner or later, and sadly sooner, just not only deteriorates but does not function. And it is a disease of the brain, though, correct? The brain is trying to send signals to the muscles, but something's wrong in between.
Yes, exactly. It's a neuromuscular disease. So the problem's not in the brain. It's with what's happening between the brain and the muscles. Those neurons that carry the messages are what's broken. So that's why we don't really see a lot of manifestation of the disease in the brain per se. It's still functioning quite properly. It's in the muscle movement that the brain cannot initiate.
Is the research almost, because you are looking at that channel between the brain and the rest of the body, is the research kind of similar to what the Miami Foundation would be doing with spinal research for people who have had spinal injuries?
ALS is really a specific disease, and I've heard researchers say before that if they find a cure for Huntington's, Parkinson's, Alzheimer's, since these are all neurological type diseases, often they say a cure for ALS would soon follow. And likewise, ALS for these other diseases. These are kind of the research that is intertwined together because they're all neuromuscular related. And
something like the Miami Project is basically because of injuries,
right,
but yet they are still trying to make a better connection with the nerves to tell the body to move those specific muscles.
Right.
It is just the thought of the research is so complicated. It's probably far beyond any of us.
It's Greek to me, I know. I get the basics, but sometimes those researchers talking, they are so intelligent. And I truly know that these researchers that we're funding are the best and the brightest in the world. And they are making progress. It's just difficult.
When we talk about early symptoms, do people have these early symptoms for quite a long period of time before they even... Could they be very minor to where they really don't even go to a doctor for quite some time?
We do see patients that it takes a long time to get a diagnosis because they see these symptoms, but they don't seem that severe, and it takes them progressing before they go to the doctor and say, hey, something's wrong with me. And then on top of that, there is the long process of diagnosis. And a lot of times, by the time we see these symptoms manifesting themselves, like I said, many motor neurons have already died. So it's very difficult to treat.
Yeah. We're talking with Kamden Kuhn, who's Public Relations Director for the ALS Association Florida chapter. Let's talk about the organization, first of all. What's the overall mission? Is it more to fund research than anything else?
We are looking to fight on every front to find a cure and offer care for those living with ALS. So while it is funding research, we also are funding patient care because we don't want to leave behind we don't want to just look at the patients in the future, but we don't want to leave behind these patients living now. We have to offer care and improve their quality of life. And unfortunately, that's all we can do while these scientists are waiting and hoping to find a cure and an effective treatment, we're working to provide medical equipment, support groups, respite care to improve the quality of life for people living with ALS.
When you talk
today.
about medical equipment, what does that entail?
Oh, it could entail a power wheelchair, which might cost somebody $25,000. We're able to provide this for free because we do have equipment loan closets. It could be like a Hoyer lift, which helps an ALS patient be lifted from their wheelchair to their chair or from their chair to their bed. It could be an augmentative speech device, and these are electronic devices that allow ALS patients to type into a computer what they want to say if they still have movement with their hands, and then that computer speaks for them.
Now, Tom is going to do that when we speak with him in a little while. Tom and Christina Olson were here last year, and Tom was mobile, and he was able to speak last year, but his condition has deteriorated to the point where he uses this, what is the machine?
It's an augmentative communication device. It's a speech device, and so now he's completely relying on that to communicate with his family and friends.
Yeah, he's a very lucky guy to have that family because they were a real treat when they were here last year.
The cutest kids ever, too.
Yeah. Is there any drug that's proven to relieve symptoms? Now, when we talk about symptoms, we're just talking about loss of muscle, or is there pain involved?
There are pain in some cases, and that's like muscle cramps. It doesn't happen in every ALS patient. However, when it comes to drugs, there is only one FDA-approved drug for ALS. It's called Rolutech. And unfortunately, it's very expensive, sometimes about $1,000 a month.
Wow.
It's only been proven to extend life for an ALS patient by about 12 weeks. So some patients who can't afford it simply choose not to take it. Exactly. Because the benefits are minor.
Is it used to kind of stabilize someone, or you said extend their life 12 weeks? That's only 3 months.
So kind of to slow the progression.
But not...
There is nothing that can stop the progression. There is nothing that can stop the loss of muscle.
Yeah.
What happens is when the muscles can no longer be used because of the paralysis, the muscle wastes away, atrophies.
Yeah.
So a person becomes weaker and weaker until eventually they're completely immobile.